Hello students, another very common condition around the peri-anal region is peri-anal abscess, peri-anal sepsis. Okay, so what is the cause of peri-anal abscess? Etiology. See, in majority of the cases, it's about 90%, it's the cryptoglandular theory. As you know, there are anal glands present in the intrasphincteric space of 6 to 14, which opens via a duct into the human of the anal canal at the level of the dentate line at the base of this crypts of Morgagni. These anal glands sometimes become obstructed by stool, foreign body, or sepsis, anyway, fibrosis. These anal glands become obstructed, duct become obstructed, secretions pent up, becomes infected, and then it spreads in the path of least resistance. Okay, so the etiology commonest is cryptoglandular. Other uncommon causes of peri-anal sepsis are inflammatory bowel disease like ulcerative colitis, Crohn's disease, or it can be because of certain surgical trauma, as we do in hemorrhoidectomy, fistula operation, episiotomy, prostatectomy, or it can be because of the direct trauma to the peri-anal region. Other conditions which can lead to peri-anal sepsis is malignancy in and around. Okay, the anal canal can also lead to peri-anal sepsis. So cryptoglandular theory, ulcerative colitis, Crohn's disease, and then you have trauma and malignancy are the causes of peri-anal sepsis. What are the spaces in the peri-anal area? You see here, there is one space here which is called ischio-anal or ischio-rectal space. It is the space between the perineal skin and the levator ani by the side of the anal canal. There is a potential space here. Pus can accumulate here. There is a space just below at the anal verge, peri-anal abscess. There is a small space in the submucous region here, submucous abscess, and pus can accumulate here in between the internal sphincter and external sphincter, intersphincteric abscess, and pus can accumulate above the levator ani muscle, supralevator abscess. Okay, so how do we classify peri-anal abscess? We classify it into four types basically: peri-anal, intersphincteric, ischio-anal, and supralevator. So there are four types of peri-anal abscesses, most commonly peri-anal, intersphincteric, ischio-anal, and supralevator. Okay. Now, how the patient of peri-anal sepsis will present to you? Basically, since it's an abscess, the patient will complain of throbbing pain in and around peri-anal region. Or sometimes if the abscess is in intersphincteric plane or in submucous space, patient will have pain deep inside the anal canal. And because of the pus, patient can also have fever, rigor and chills, not feeling well. Okay. When you examine such patients, you will find that in the peri-anal abscess, there is erythema, fluctuation, tenderness in the peri-anal region, and sometimes if the abscess is inside, as I said, in intersphincteric area or the supralevator area, there will be nothing outside. When you do a DRE, you will feel a hot fluctuant swelling in the just beneath the mucosa, and sometimes it can be very painful. Patient will not allow you to do that, and then you know that there is some pus collection there in the either in the intersphincteric submucous or suprasphincteric or supralevator space. Okay, so how do you confirm this? Well, peri-anal abscess, it is outside, you don't need to confirm, but sometimes in the intersphincteric abscess and supralevator abscess, you will have to do some investigation like CT scan, MRI, and sometimes we do an endoanal ultrasound. That's a very good investigation where ultrasonic probe is introduced inside the anal canal, and that will show you the pus collection. Where is the pus collection in between the sphincter or in the supralevator space? Okay, so how do we treat such patients? Obviously, if the infection is in cellulitic stage, you give antibiotic to these patients covering gram-negative bacteria, E. coli, Klebsiella proteus and things like that. And if the fluctuation is there, abscess stage has reached, it is in the peri-anal or in the ischio-anal stage, we give a cruciate incision is given. Cross-like incision, a cruciate incision plus incision is given. You can look here, and this will lead to drainage of the abscess and relieve the pain. If the pus is inside, as in submucous